Hi everyone, I am Rosalyn Anita, nursing tutor in Tribhulam College of Nursing. Today I am going to present a topic on safety devices in nursing. Safety is one of the most important responsibilities in healthcare. Nurses use various safety devices every day to protect patients, prevent infections, reduce accidents, and ensure quality care. In this presentation, we will discuss different safety devices used in nursing, their importance, advantages, and challenges. The objectives are introduction, importance of safety devices, types of safety devices, personal protective equipment, hand hygiene and infection control devices, needle safety devices, patient monitoring devices, fall prevention devices, emergency safety devices, medication safety devices, isolation and biohazard safety devices, benefits of safety devices, challenges and limitations, and conclusion. Introduction to safety devices. Definition: safety devices are tools, equipments, or systems used to prevent injury, infection, accidents, and medical errors in healthcare setting. Purposes: protect patients, protect nurses and healthcare workers, prevent infection and accidents, improve patient safety, care quality. So, the safety devices are essential in hospitals, clinics, and nursing homes. They help create a safe environment for both patients and healthcare workers. Nurses handle many risks daily, including infection, sharp injuries, falls, and medication error. Safety devices reduce this risk and improve healthcare outcomes. Why safety devices are important: prevent hospital acquired infections, reduce patient injuries and falls, prevent needle stick injuries, improve patient recovery, maintain hospital safety standards, protect healthcare staff from occupational hazards. So, the safety devices are extremely important because hospitals are high risk environments. Patients may already have weak immune system and healthcare workers are exposed to many hazards. By using safety devices correctly, the nurses can prevent infection, injuries, and medical complications. Types of safety devices: personal protective equipment, infection control devices, patient safety devices, emergency and life saving devices, medication safety devices. So, the patient safety devices is nursing can divided into different categories based on their functions. Some devices protect healthcare workers while others protect patients or assist during emergency. Personal protective equipment. So, the common PPE are gloves, surgical mask, N95 mask, gowns, face shield, goggles, shoe covers. Functions are prevent infection transmission, protect from blood and body fluids, reduce contamination. So, the personal protective equipment or PPE is one of the most commonly used safety measures in healthcare. The gloves protect hands from contamination, masks protect the respiratory system, and gowns prevent exposure to infection material. So, the PPE becomes especially important during the COVID-19 pandemic. Coming to infection prevention devices, the examples are hand sanitizer dispensers, soap dispensers, touch-free tapes, sterilization machines, UV disinfection devices. The importance: reduce spread of microorganisms, maintain hospital hygiene, prevent cross infections. So the hand hygiene is considered the most effective way to prevent infection in hospital. Nurses must wash or sanitize their hands before and after patient care. Modern hospital also use sterilization equipment and touch-free devices to reduce contamination. Coming to preventing needle stick injuries. Devices used are safety syringes, retractable needles, needle destroyers, sharp disposable containers. The risk prevented: HIV infections, hepatitis B and C, and bloodborne infections. Needle stick injuries are one of the most common occupational hazards in nursing. Safety syringes and proper sharp disposal help reduce the accidental injuries and prevent the spread of serious diseases. Monitoring patient health. Devices are thermometer, pulse oximeters, blood pressure monitors, ECG monitors, glucometers. The purpose is monitor the vital signs, detect complications early, improve the patient care. So the patient monitoring devices helps nurses assess the patient condition continuously. For example, pulse oximeters measures oxygen level, while ECG monitors track heart activity. Early detection of abnormalities can save lives. Preventing patient falls. So the devices used: bedside rails, wheelchair brakes, non-slip footwear, walking aids, bed alarms. High risk patients, elderly patients, post surgery patients, weak or unconscious patients. So the falls are the major concern in hospitals, especially among elderly patients. Safety devices such as side rails and bed alarm help nurses prevent accidents and injuries. Emergency and life-saving equipment. Examples are defibrillator, oxygen cylinders, suction machines, emergency crash carts and ventilators. The importance: used during emergencies and supports the life-saving treatment and improves survival rates. These devices are used in emergency situations such as cardiac arrest or breathing failure. The nurses must know how to use them quickly and correctly to save patients' lives. Coming to safe medication administrations. So the devices are infusion pump, automated medication dispensers, barcode scanners and smart IV system. The benefits are: reduce the medication errors, ensures correct dosage, improves patient safety. So the medication error can seriously harm patients. Modern medication safety devices help nurses administer the right medication in the correct dose and at the right time. Coming to infection isolation measures. Devices and systems: isolation rooms, biohazard bins, PPE disposable containers, air filtration system. The purposes are: prevent spread of infectious diseases, protect patients and staffs. Isolation devices and systems are especially important for contagious diseases such as tuberculosis or COVID-19. Proper waste disposal and air filtration help control infection. Coming to benefits of safety devices: reduces infections and injuries, improves patient care quality, protects healthcare workers, increases workplace safety, and builds the patient trust. Safety devices improve the healthcare quality and create a safer hospital environment. They also help nurses perform their duties more confidently and effectively. Efficiently. Challenges and limitations. So the common challenges are high cost of equipment, lack of proper training, and equipment shortages, and poor maintenance and improper usage. Although safety devices are very useful, hospitals sometimes face challenges such as limited budget, lack of training, or insufficient equipment. Pro- Proper education and maintenance are important for effective use. Conclusion. Safety devices are essential in nursing practice, protect both patients and healthcare workers, and prevent infections, injuries, and medical errors. Proper training and maintenance are necessary. So, while concluding, the safety devices play a very important role in nursing and healthcare. They improve the patient safety, reduce the risk, and support quality care. The nurses must understand how to use these devices properly to create a safe healthcare environment. The references are Fundamental of Nursing, Potter and Perry, and World Health Organization's Guidelines on Patient Safety and Infection Prevention, Nursing Foundation Concepts and Clinical Skills. Thank you for listening.